Thank you so much for coming in. My name is Oiku. I'm the dry eye coordinator here at Eyes on Shepherd. And I have Dr. Jordan Friedman and Dr. Michelle Barron here, who is our dry eye practitioner, who has over 10 years of experience in this field in diagnosing and treating dry eye disease. So our presentation will start by talking a little bit about what dry eye is and the treatment options, mainly focusing on the JET technology. And we'll see some real life patient experiences as well as their testimonials and look at the ocular aesthetic portion of this treatment that we offer for our patients. So I'll hand it off to Dr. Barron to start the presentation.
Perfect. Well, thank you everyone for coming out on your rainy Wednesday night. Thank you for being here. I hope that at the end of the day, you guys find value in what me and Dr. Friedman and Oiku share. My guess is that you're here because your eyes really bother you. I once had a patient say to me, if I could just take my eyeballs out of my head and hang them outside of my face, my whole life would feel better. And so that is often how dry eye sufferers feel. You know, the rest of their life is good, but they're constantly thinking about their eyes throughout the day. And so we're going to talk about really the basis of the disease and some of the new modern options that are out there. When I first graduated optometry school, there was very little we could do for dry eye disease. There was very little known about dry eye disease, and there was very few solutions of what we could do. We could really just get you on lubrication eye drops. We could have you use a warm washcloth at home to moisturize your eyelids and steam your eyelids. And we could maybe recommend some Johnson & Johnson baby shampoo to clean your lashes, and that was it. And I really didn't like dry eye because I felt like there was nothing I could do for my patients. They were miserable, they were in a lot of discomfort, and we didn't really have any viable solutions for them. Dr. Friedman joined the practice not long after me, and he said, I love dry eye. I want to specialize in dry eye. And I said, great, you can have it. Because, there was very little we could do. Technology and knowledge and research has changed a tremendous amount in the past decade when it comes to dry eye treatment options and investigation and what we can do. And so that's what we're going to walk through a little bit today and see if there are any, solutions or aha moments that you guys get and anything you would like for myself or for Dr. Friedman to investigate further with regards to dry eye. After that, we'll pass it over to Oiku, who will talk about some of the aesthetic benefits that we get from some of our dry eye devices that are a nice happy perk here at the optometry office. So what is dry eye? We got a much better understanding of dry eye back in 2017. Before we would say dry eye, your eyes are dry, there aren't enough tears, use a lubricant drop. It was, in essence, like using a Tums in your stomach as an antacid. It was just helping the symptoms. But we know a lot more about it now. And so what do we know? Well, we got a really good definition of dry eye back in 2017. It has since been further elaborated on back this past year in 2025 with some mass research studies being done on it. But what it is essentially a multifactorial disease. So dry eye is classified as a disease. Multifactorial, meaning there are a lot of factors that are going to be contributing to it in each individual. It is not just a one and done. It is not just happening because of one situation. It's multifactorial. There are a lot of things contributing to it. It's a symptoms-based disease. It's symptomatic. People feel the problem of the disease, and sometimes people will feel the symptoms a lot more than we even see signs of it. Or vice versa. We're looking at the cornea, and it is like the Sahara Desert on that cornea, and I ask the patient how they're feeling, and they're like, I'm fine. That's usually when dry eye has become so bad that you just lose sensation of your cornea, and then it stops bothering you. So symptomatic, characterized by the loss of homeostasis. What does that mean? It means the loss of balance. I think of the surface of the eye and the eyelids as its own little biome, its own little biodome. And everything needs to be at play. The tears aren't just water. The tears are made up of all sorts of, interesting molecules, including hormones. There's hormone receptors on the surface of the cornea. So if we're talking about multifactorial, well, what are one of the factors? Changes in our hormones, especially for women, but even for men. Testosterone is one of the main receptors on the surface of our cornea. When it comes to dry eye. But it's that whole balance of the inflammatory markers, the saltiness of our tears, which we refer to as osmolarity, the pH balance of the tear, and it all has to be nicely balanced. And if that gets knocked out of balance for whatever reason, that's when we start to get what we call dry eye disease, or more technically known as ocular surface disease. The surface of your eye is out of balance and we need to recalibrate it. And so that can lead to tear film instability. The tears are disappearing too fast on the surface of your eye. Or in reverse, the tears aren't the right consistency, so they keep tearing on the surface of your eye. Patients will say to me, Dr. Barron, my eyes are watering all the time. And I'll say, aha, you have dry eye. And they say, no, you didn't hear me. I said they're watering all the time. And I said, yeah, you have dry eye. And that's a reflex tear. That comes because the balance is off. And so it keeps trying to fix the problem. And it makes these really runny, seeping tears that do not stay on the surface of your eye. It also involves hyperosmolarity. If we test the saltiness, the osmolarity level of your tears, if you have dry eye, they are too salty. We have to recalibrate that. There's ocular surface inflammation. So this was a big discovery in the research of dry eye. Dry eye is an inflammatory disease. It is inflammation that is driving this loss of imbalance, just like so many other diseases in our body. And so individuals who have more inflammation in their body, whether it's autoimmune conditions, whatever diseases they might have that has inflammation in their body, again, another factor that can be contributing to your dry eye. So we will see more dry eye in individuals who have rheumatoid arthritis, lupus, and other inflammatory diseases. What we also know is often to quiet down the dry eye and to help recalibrate that homeostasis we need, we have to get at the inflammation. We have to get rid of those inflammatory markers that are in the tear film. And if we measure the inflammatory markers in the tear film, individuals with dry eye have higher inflammatory markers. And what we'll eventually start to see is damage to the surface of the cornea and damage to the nerves on the surface of the cornea that help to process the signaling loop. And that's eventually when we get to the point that the signals are just no longer signaling properly, and we either have an overproduction of tears, a decrease in any pain or sensitivity, because the whole system just eventually went so far out of whack. And so we know now it is not just something to throw lubricant drops at and say, try these lubricants and get back to me in a year and, pick up your favorite one. If we really want to get to the bottom of dry eye disease, we need to figure out A, what is causing it in this particular individual, and B, what are the different, multiple tools in our tool belt we need to use to start to get to the bottom of it. What are the common symptoms? I already brought up a lot of these in the definition, but these are the most common symptoms of dry eye. Burning and stinging of the eye. Again, people will all describe their symptoms as different, but burning is a real classic one. Sometimes along with that burning, there'll almost be an itchiness building up, especially at the rims of the eyelid or kind of deep below. And I think this is what that patient who said she wished she could hang her eyes outside of her body. They were just so aggravated. Redness. We will see redness, but not always. Your eyes don't have to be red to be dry, but will come sometimes when the surface is all inflamed. Inflammation comes along with redness. Blurred and fluctuating vision. This is a big one. And this is one where patients get particularly bothered because this is where it starts to impact your daily activities. If you don't have a balanced tear film on the surface of your eye, your vision can go from clear to blurry moment to moment. You could have the best glasses in the world, but if you're looking through a foggy surface with unstable tears, think of looking through your windshield in the middle of a rainstorm without working windshield wipers. The rain keeps moving, it keeps changing, and you can't get a clear surface through the glass of your car. That's what happens with dry eye. So you will get blurred vision that comes and goes moment to moment. And sometimes using a lubricant drop will, even out those tears for a period of time, and they last however long they last, and then they continue on. Gritty or sand in the eye. This is a classic dry eye sensation, that grittiness. People will say, I think I have sand in my eye. I feel like there's something in there. And I search and I search and I search, and it's not. It's dry eye. It's that there's inflammation and you don't have a good lubricant over the surface of the eye. So you're feeling that interaction between your lid and the ocular surface. And so that is a classic dry eye sensation. And then last but not least, like I said, watery eyes, which is actually a reflex from your body that is trying to fix the problem. But what it does is it produces these really runny, watery tears that don't sit on the surface of your eye, that aren't the proper composition, and so you don't get the relief that you really do wish you can get. What can cause dry eye? Like I said in the definition, it's multifactorial. There are all sorts of reasons why we can get dry eye. 80% of dry eye patients also have what's called meibomian gland dysfunction, or MGD, and maybe your eye doctor has said that term. Sometimes we label it blepharitis. So if you've heard that you've had blepharitis, some people will say MGD, and sometimes colloquially I'll even just say the glands that make your tears are blocked. What MGD is the glands that line our eyelids, which are responsible for the oil component of our tears, they get blocked. And so you can still make the water component of your tear, but if you're not making that oil component of the tear that keeps the tear on your eye, this is when they just evaporate off of the surface very quickly. So 80% of dry eye has an MGD, or meibomian gland dysfunction component to it, which are around the eyes. And so that's why we'll say do hot compresses. Because what does heat do? Well, it helps to open up those blocked glands. But if we're not heating them long enough or to a high enough temperature, we'll sometimes, or if they're just extremely blocked, or if there's a lot of inflammation already brewing from other conditions, like let's say rosacea, we won't necessarily feel the gains of that hot compress. So meibomian gland dysfunction means you're not making the meibum, which is that oil component of your tears, and it is lacking. And so your tears do not stay stable on your eyes. Screen time. Who's looked at a screen today? Right? All of us. So this is a big factor as to why we are seeing much more rampant dry eye occurring. Whereas dry eye used to be an old person problem because of hormones and medications that we're on and loss of, liquid volume in our body and everything. I now see dry eye on children, whereas it used to never be a problem that we would see on children, and that's because of screen time. When we stare at screens, we blink 66% less of the time. So when you're engaged in something and you're staring at your screen, you're not blinking. And if you don't blink, you're not refreshing the tears on the eye. You're not squeezing those meibum glands that we just talked about. And so if you're not squeezing and pumping out the oil, eventually what happens to liquid that doesn't move, like a swamp, it gets stuck. It gets static, and then eventually it gets blocked. So screen time is a huge contributor to dry eye, along with that reduced blinking that comes from screen time. Aging and hormonal changes, I alluded to this already. As we get older, we just naturally produce a lower volume of tear, so we just don't have as many tears to go around. As we get older, our hormones change, and as they change, again, we start to see more dry eye. We do not produce as good quality tears or as many tears. The testosterone receptors on our eye don't get the feedback that they need. And so that homeostasis, that regulatory mechanism starts to, dwindle away and fall apart a little. What also we'll see, not necessarily with aging, but a lot of times with aging, it's not on this list, but it's medications. If you're on a medication that has the word anti in it, antihistamine, anti-anxiety, antidepressant, anti-cholesterol, all these medications dry our eyes out. And that's why on most medication lists, now some medications can have real impacts on different parts of the eye, but on most medication lists, what if a side effect is blurry vision? A lot of times that's actually because of the dryness that it can cause on the surface of the eye. So again, we're living longer, we're on more medications. Those medications can be drying out our eyes. Now, I'm not saying go home and stop your medication. Don't do that. Stay on your medication, but that could be a reason also why we're seeing more dry eye and why we see it more in an older population. Contact lens wear. What are we doing with a contact lens? We're taking a 50 micron piece of plastic and we're putting it in an 8 micron tear film. It does not help dry eye, it will only make it worse. So if you are a contact lens wearer, I'm not saying no contacts, but that's another contributing factor. And then environmental factors. We live in Toronto. In the winter, it is very dry. Our dry eye gets worse in the winter. We also now in the summer have forest fires. These forest fires are also interacting with the mucous membranes on the surface of our body, including our eyes, and they're only making them worse. And what ophthalmologists and allergists are finding from the ramifications of these forest fires and the pollutants that are coming out into the environment is that they're not just causing irritation and increased inflammatory markers and factors at the time of the forest fire being around. As they're researching the tissue and the effects on the tissue more long term, they're actually seeing that there are permanent effects that it's having in all of our mucous membranes, including our lungs, but where it's really just raising all of our inflammatory markers to make our bodies much more heightened to irritation in the first place. So we're not just seeing it at the time of the forest fire happening, but a lasting effect of irritation that's coming beyond those environmental factors. So that's again another contributing factor. Okay, so that's what causes it. That's not even everything that causes it. There's way more, but we're going to be mindful of your time tonight. But a sense, you probably noticed at least one or two items on that list that likely speak to you in general. What can we do about it? I always like to start with at-home treatments first, because if we can treat it at home, perfect. And a lot of times it will work, so, my method, and this is not every optometrist's method, is, okay, well, let's start with the simple basics. Let's start to get your tear film, back into proper chemistry using a tear drop that is specific to the reason why you have dry eye. You go to the shelf, you see a million dry eye drops. Well, why are they so many? They all have different compositions. And so if we can analyze the causes of your dry eye and what's the reason that your tear film is unstable, is it that mucin that comes out of the glands? Is it the liquid component? I want to put you on a drop specific to your dry eye. If you're a candidate, depending on, again, the cause of your dry eye, I'll also recommend warm compresses, but making sure we're doing them the proper way, not just a damp washcloth, running over the sink and making a mess of everything, but really making sure you're getting lasting heat for 8 to 10 minutes, that's staying on your eye and getting to a hot enough temperature. Lid hygiene, a lot of times people with dry eye will also have what we call blepharitis, and Demodex, which are little mites that live in our eye. Again, we have mites and bacteria all over the surface of our body. There's a mite in particular, and I think we actually have a very kind picture of it later in the slides. It looks really cute, but it actually kind of looks like lice, and they live at the base of our lashes, and they can, if you have an overgrowth of this kind of mite around your eye, it is a huge factor for dry eye disease. And so what's the treatment plan? Well, the treatment is to kill the mite. So again, finding the root cause of the dry eye and then using whatever lid hygiene, wipes, sprays, compresses you would need to make it feel better. We also know omega-3 can help dry eye. Omega-3 has anti-inflammatory properties. What is dry eye? It's an inflammatory process. Research has shown that there is a specific formulation of omega-3 that works better with dry eye. It is different than the formulation that is good for our brain. So if you're taking a supplement high in DHA for your brain, that's great for your brain, not necessarily the right compound for dry eye, but that can also help with dry eye symptoms. If that is not working on its own, and again, I give it, a number of weeks, and then I have Oiku check back with my patients, unless they've already been doing it. But let's say you've been doing nothing. And that's where I start you off to see, well, can that help you on its own? It typically takes about 6 to 8 weeks to not make it better per se, but to start to feel improvement. And I'll have Oiku check in with you. And if it's not better, or if we want to escalate it, then there is way more things we can do these days. Like I said, when I graduated, there was hardly anything that we could do, and now there is way more. And so we're going to break through some of those things we can do. We can get you on medications, long-term chronic eye drop medications that can improve dry eye. The two that are listed, Restasis and Cequa, those are both cyclosporins. Cyclosporins are an anti-inflammatory drop. What is dry eye? It's inflammation. So we have that to get you on. So again, if our over-the-counter drops aren't working, there are medications we can get you on. There is also red light therapy. What red light therapy is, and some people might have heard it in other areas of medicine, for hair growths, for sports medicine, they're using it to help with the regeneration of cells. Red light helps to stimulate the mitochondria in our cells and helps for better cell proliferation and life and regrowth. You'll see those fitness clinics that have the red lights overhead, or the spas that have the red lights. That's, utilizing the same mechanism. And so there's now red light goggles, and we have some here somewhere that you can wear. Oh, right here, that you can use 3 minutes every other day. You wear them like goggles, and what red light does is, again, it helps to recalibrate that homeostasis on the surface of your eye, reduce inflammation, and has been shown to lower dry eye symptoms. So again, these are things that can be done at home, kind of in my head, tier 1, entry level dry eye. A lot of people will have tried it even before entering my exam chair. And then tier 2, long-term medications, red light therapy. And what we also have as tools in our tool belt now are in-office treatments. Back about, what do you say, it's 15, 20 years ago now, I think it was around 2004, 2006, there was a doctor in the US doing IPL, which is intense pulse light, which is this device over here, doing IPL treatments for rosacea. From a dermatology point of view, was doing IPL, intense pulse lights, on the skin for rosacea. IPL uses a special band of light, not a laser, but light, that helps to really close off the vessels in our body. People who have rosacea, they have those really rosy cheeks, those rosy nose, they have very superficial blood vessels. And as they were doing those treatments, they were reporting back to the dermatologist, my eyes feel way better. My dry eye symptoms feel much better. And that was the start of them investigating how can these dermatology devices that act on the skin also work hand in hand with dry eye disease. And from that, we learned that using IPL around the cheekbone and the upper and lower lids, again, has anti-inflammatory properties and helps to quiet down the inflammation that's driving the dry eye. A lot of patients who have dry eye will notice the rims of their eye have redness to them. Those are blood vessels growing at the surface of your eyelids in those meibum glands at the surface of that region. And that's really what the IPL is getting at. From there, they started to investigate other dermatology devices into the use of the dry eye realm. And that's where they learned about radio frequency. Radio frequency is almost like doing a super hot compress over your eyelids to be able to extract out all of the meibum, or how I'll explain it to my patients, the gunk that is trapped in those glands that are not exiting onto the surface of your eye, to help eliminate that and get that out of the glands. And then lastly, the device we're going to talk the most about, because Dr. Friedman and I are just getting absolutely resounding results with, is the Jet Plasma device. This device really entered the space automatically as an eye device and a skin device. And that was because they already were starting to research how devices can be used in the dry eye world. And so he's going to jump into a lot more detail on the Jet Plasma, but this is really our both of our first lines of treatment in office if we want to do an in-office treatment. And so when we talk about doing an in-office treatment, we often are sending our patients home with whatever drops or vitamins or red lights specific to their case of dry eye. But then if they're not seeing gains, or if we simultaneously want to hit it really hard, really bring down that inflammation, open up the glands, we'll start to recommend the Jet Plasma device. And so Dr. Friedman's now going to take over and go into what is this device doing, what is the mechanism of action, and why are we seeing such great results.